This is their entire resupply area for clinical supplies. You want 4 to 6 weeks worth of stock, and you want it to be visual, which means you're taking things out of boxes, so that way you can see exactly, how much you have left. And then you can take this, you can standardize this and Kanban it, and maybe for some of your most used items, you can actually mark, hey, this is a 2-week mark, right? And maybe this is a 6 weeks mark, depending. Okay, you don't need to necessarily do this for every single item, but it is the next step of continuous improvement once you have everything set up and sorted. Dr. Potts, I would love to. You've had the training. Have you guys got to the standardized Kanban yet, where you're allocating minimums and maximums of inventory? No. I didn't show. I'll make sure I talk to Leo because he missed that segment, but that would be the next level. So, yeah.
You said 4 to 6 weeks. So how often is it being?
Once a month is the goal.
Once a month is ordering?
That is the goal. You're still going to utilize, weekly checklists because I can do a quick scan to make sure, just to cross-check for human error, if you would. But nope, it would be
any, like, looking ahead on the schedule, or is that necessary?
no. Only thing, implant case.
Okay.
But other than that, which is you can kind of treat like a lab, but besides that, no. And so how do we do this? Well, one, we need to sort everything out, and we need to see, is this something we use or is it something that we don't? So a lot of times for offices that took over from another practitioner, a lot of times you have all of these things and you're like, oh, that could be useful one day. And then it ends up on the top shelf or up on there. It's actually doing a detriment and even more of a detriment if you're tight on space. Get rid of it. We want to consolidate. So it is, not necessarily Stephanie's way or Erica's way. It's going to be the Westgate dental way. And you want to create a standard because now you have something to compare to. Same thing on the hygiene side as well. Depending on the level of the giveaways that you're given, you can see where you can have it can start to really kind of pile up. So consolidate to as much as you possibly can. If one thing does the same for 2 different, use that with some flexibility. And then, if your productivity changes, you need to reevaluate those, which is, if you can kind of see those crest boxes up at the top, okay? So that's a perfect example. When we first started, that's the adult toothpaste. So they got 2 versions. Sensitive, I'd love one, but you have to have a sensitive. So sensitive and a regular. If you're seeing kids and you need a separate kids one. But instead of 1 bin, they're probably going to need 2 bin. That holds, they got about 2,000 tubes of toothpaste up there, and their 1 month supply is 1,000. So they should be able to hold 1,500 would be kind of their metric. So what's going to happen? Well, people are going to pull from there instead of there because it's harder. Can't reach that, right? I can reach this. So usually what happens is when stuff starts to get expired, and then now you got to throw it out. I did check those. They are not expired. And they're like, guys, let's go. And then you got to troubleshoot. And there it was. We haven't reevaluated what our minimums and maximums are. And we need 2 of those big tubs instead of 1 now. And like items being grouped together. So we are very strategic. In our ops, we got 1 week's worth in our bins. We're bringing those right onto this counter to restock. So we're always looking for, where can I minimize steps all throughout the way. The lab should be connected here to your sterilization and resupply, because if there is any lab work in the appointment, once you drop off dirty, you're immediately going into the lab. Or, if they had the lab here, but the entrance, the doorway was another on the hallway, which I see all the time, now I got to walk all the way around and come right back here because I'm going to grab clean now to go into the operatories. We're looking at those things on that level because that's where you're going to be getting that efficiency. It's 5 seconds here, 30 seconds there, 1 minute, that starts to add up. And then you get to choose on what you want to do with that additional time. Do you want to just get out on time? Do you want to serve more patients, or do you want to add in more services within that appointment? Some higher end stuff, whatever, you get the choice to do so. So here's sterilization. So how do instruments flow? Well, sterilization starts at chair side. I don't care what you're using in here or the process, it starts there. There is no cured resin or bond in the world that's going to come off of that. If it's like cured, you need a 12-hook blade to go ahead and scrape that off. So chair side, cassettes are inspected, closed. It should not open again until it's run through this process and it's been sterilized. So then from there, it goes into here. This is a holding. There's no minimum or maximum amount of time. It's just the coenzymatic soak. So washer, and you can do a residential like this. You can do a commercial. That's a little bit more expensive, but it is the fastest. Or you could do a dental specific, which is the most expensive, and it has an hour time as well. It depends on what the overall goals. If you could work it into the budget, I would recommend the commercial, which is what they use in restaurants. The only state that can't do that is Nevada. And then from here, they get packaged, so all your stuff here. And then this is the rate limiting factor, is your autoclaves. I can skimp everywhere else except for here. So you want large capacity. Here I'm 11, your now we're easy 11. Or, if you wanted to look to upgrading, maybe get into a system B, something like the T-Edge or the post-vac, something along those lines. You can, and then this scales based on the size of the practice. So day 1, he had 10 ops. We didn't have all 4 of these autoclaves, but we had 2. And we added the dry heat after training. We use that primarily for burrs and ortho. If they were doing ortho here, just protects the longevity of the burrs a little bit longer. Take the water out. This is important, following details. So that airline is planned for here, because that's where I want my handpiece lubricator. Things got changed up on site by construction teams, because you know what? We also need air over there. Oh, so we can just hook it up into that room. No, big problem, because now I'm going here and I'm going here. If I kept it there, the chances are higher that she might have ran that and packaged it and go. But because it's out of this zone, she's dropping it off and get going. Electric handpieces are super expensive. So usually offices don't have an overabundance of this. It's very important to have the one-piece flow and to take it to as far as you possibly can before you make that transfer, because it's going to be easier for the next person who receives that.